Good evening, friends. Welcome back to the channel. Today is July 29, 2026, and we are witnessing a historic shift in how tomorrow's medicine is governed. If you've been following the AI boom, you know that artificial intelligence is rewriting healthcare. But today, the regulatory Wild West is officially coming to an end. India's top regulatory body, the CDSCO, Central Drug Standard Control Organization, has just dropped a comprehensive framework outlining exactly how AI and software-based medical devices will be legally evaluated under the medical devices rules. Why does this matter to you? Because AI diagnostics, automated imaging, and predictive patient software now have a clear, rigid legal pathway to clear clinical trials and reach your local hospital safely. It cuts through the red tape for digital health innovators while establishing rock-solid safety boundaries for patients. We're starting our global roundup right here. The era of unchecked medical AI is over, and the era of standardized, heavily vetted digital medicine has officially begun. Segment 2, Global Health Tragedies and Triumphs, WHO and PAHO Updates. Next up, the World Health Organization, WHO, has released a massive departmental update today out of Geneva. They have fundamentally overhauled the global treatment guidelines for visceral leishmaniasis, famously known as Kala-Azar or black fever, and its secondary skin condition, PKDL. Transmitted by infected sandflies, Kala-Azar remains one of the world's deadliest parasitic killers, second only to malaria. The new WHO regimens drastically improve patient care and tolerance across highly endemic zones in Eastern Africa and Southeast Asia. This is a massive victory for global health equity. Meanwhile, looking across the Atlantic, Brazil's Ministry of Health has officially applied to the Pan-American Health Organization, PAHO, for validation that they have eliminated mother-to-child transmission of hepatitis B. To qualify for this monumental health milestone, Brazil successfully dropped its active hepatitis B prevalence to under 0.1% among children under 5, backed by an astounding 95% antenatal care coverage rate. This proves that coordinated public health policy can completely choke out chronic viral inheritance. Segment 3, The Hidden Pandemic, Obesity Underdiagnosis Study. Now, let's talk about a silent crisis hiding in plain sight. A massive global study published today, tracking over 6.7 million adults across the US and Japan, has revealed that obesity is severely underdiagnosed by clinical professionals. Get these numbers: despite having massive rates of secondary conditions like type 2 diabetes, chronic kidney disease, and heart failure, 70.1% of eligible patients in the US and a staggering 97.7% of eligible patients in Japan had absolutely zero record of an official obesity diagnosis in their medical charts. Doctors are treating the symptoms, the heart failure and the diabetes, but completely missing the structural root cause in their electronic health records. This lack of formal tracking blocks patients from receiving next-generation weight management interventions, severely skewing how public health bodies fund chronic disease prevention. Segment 4, Pharma and FDA Watch, Macular Degeneration and Cancer Approvals. It has also been a massive week for targeted pharmaceuticals. Today, the FDA officially granted its coveted RMAT, Regenerative Medicine Advanced Therapy, designation to Ocugen's modifier gene therapy, OCU410. This therapy targets geographic atrophy secondary to dry age-related macular degeneration, a primary driver of blindness worldwide. This designation fast-tracks its development pipeline, offering immediate hope to millions losing their sight. This follows hot on the heels of the FDA's landmark approval of Jadaytro, zidesamtinib, by GlaxoSmithKline. Jadaytro is a highly selective kinase inhibitor designed specifically for advanced ROS1-positive non-small cell lung cancer in patients who have failed prior targeted therapies. Instead of carpet bombing the body with standard chemo, this molecule selectively shuts down the mutated ROS1 pathway. Additionally, we are tracking the rollout of Vera Therapeutics' atacicept, which just clinched accelerated FDA approval for treating IgA nephropathy. It works by cutting down harmful protein leakage in the kidneys by 42% to 46%, fundamentally slowing down the timeline toward total kidney failure. Segment 5, Medical Infrastructure and Education Crises. Behind the medical breakthroughs, the infrastructure that trains and supports our healthcare workers is under immense strain globally. In India, a massive political and healthcare storm is brewing over the surrender of 151 super specialty medical seats. High-profile leaders in the Tamil Nadu Medical Officers Association, TNMOA, have fiercely condemned administrative failures that caused these state-reserved seats to be transferred out to the All India quota. Medical bodies note this represents a severe loss of future local specialists who would have otherwise sustained public healthcare systems simultaneously. In Nepal, a widespread nationwide doctors' strike that left surgeries in limbo has finally ground to a halt. The Nepal Medical Association reached an 11th-hour agreement with the government following intense physician protests demanding workplace security and justice after severe assaults on medical staff. It's a sobering reminder that cutting-edge drugs mean nothing if we fail to protect and allocate the human beings who administer them. The Ebola crisis in the Democratic Republic of Congo is spreading like wildfire, from what one reads in the media, and with over 3,000 deaths already reported, infections are surging by 1,000 every day. Dr. Srinath Reddy of the Public Health Foundation of India told Stratnews Global on the Gist show that it's been localized to certain parts of Africa, mainly Central and West Africa. The Democratic Republic of Congo has experienced many outbreaks in the past, some of which have crossed the boundaries into other parts of Western and Central Africa. But it's not even affected East Africa. It has not affected Europe. In other words, the Ebola crisis is nowhere near the pandemic status that the COVID virus had. Nevertheless, the fact that it has hit DRC Congo for the 17th time tells you something is not working, and that something is the outreach in terms of getting people to give up some customary traditions. But it's not as simple as that. There is a preponderance of fruit-eating bats in the forest areas of that region. And when bat droppings, that includes the fruit eaten by the bats, if only partially consumed and if picked up by humans and eaten, then the humans are likely to contract it. Funeral traditions common in the region also increase the danger, since these involve touching a dead body, carrying it in procession to a grave and so on. Any contact with a body infected with the Ebola virus is a certain guarantee of death, he warned. Protocol demand that nobody should touch the body. People should wear protective gear, wrap up the body in plastic sheets, and then dispose it off, and this runs counter to the local culture. And if this is not properly explained to the local community by respected community elders and public health officials, then the battle is lost. Pluggy. Mothers who consumed a high-protein and low-glycemic index (HPLGI) diet during pregnancy had children with higher total cholesterol levels, low-density lipoprotein (LDL) cholesterol levels, and LDL to high-density lipoprotein (HDL) cholesterol ratios through 9 years of age than those who consumed a moderate protein and moderate glycemic index (MPMGI) diet during pregnancy. Medscape. Multivalent pneumococcal vaccine. Despite the availability of multivalent pneumococcal vaccines, infants remain susceptible to invasive pneumococcal diseases. In this French study, infants immunized against RSV with nirsevimab were about 35% less likely to be hospitalized for invasive pneumococcal disease through 9 months. The rise in pneumococcal disease cases in kids involving serotypes not covered by vaccines highlights the need for complementary prevention strategies, the researcher said, MedPage Today. Segment 6, Outro and Discussion. From AI codification to global parasitic treatments, and the structural failures in how we log obesity, today's news proves that medicine in 2026 is moving faster than our systems can handle. What do you think about the new guidelines for AI medical software? Would you trust an AI doctor to read your next MRI scan? Let me know in the comments below. Don't forget to hit the like button, subscribe for your daily dose of high-impact medical science, and share this video with anyone who needs to stay ahead of the curve. Stay healthy, stay curious, and I'll see you in the next one. Disclaimer: compiled information. This content is for educational purposes and is not a substitute for professional advice. The audience must verify the contents before use. The creator, publisher, and YouTube will not be responsible for any harm.